Imagine taking proactive steps for your colon health, like getting a screening colonoscopy. Sometimes, during this important procedure, doctors find something called a polyp. While many polyps are quite common and easily handled, some types, like the Sessile Serrated Polyp, can be a little more complex. This naturally leads to a very important question. What happens if such a polyp isn't fully removed? If a Sessile Serrated Polyp is not completely removed during a colonoscopy, the residual tissue can indeed continue to grow and may eventually develop into colorectal cancer. This specific type of polyp has a known potential to progress to cancer if left behind, highlighting why thorough removal is absolutely critical. The reason Sessile Serrated Polyps pose this particular challenge lies in their often flat, subtle appearance, making them harder to spot and fully excise compared to more raised polyps. They tend to blend into the colon lining and lack the distinct stalk or head that makes other polyps easier to grasp and remove. Furthermore, these polyps often follow a unique biological pathway to cancer, known as the serrated pathway, which can sometimes progress more rapidly or unpredictably than the more common adenomatous polyp pathway. Even a small portion of sessile serrated tissue left behind can harbor cells with the potential for malignant transformation, underscoring the need for precision. If there is a concern about incomplete removal, perhaps because the polyp was particularly large, ill-defined, or in a difficult location, your doctor will likely recommend a plan for careful monitoring. This often involves a repeat colonoscopy in a shorter time frame than usual, specifically to reevaluate the site and attempt further removal if any residual tissue is identified. The primary goal is to ensure all precancerous cells are gone and to prevent any future growth. Identifying and completely removing these specific polyps requires a keen eye and specialized techniques. Endoscopists often use chromoendoscopy, which involves dyes that highlight the subtle features of sessile serrated polyps, or advanced imaging modes to ensure they get clear margins. The critical insight here is understanding that even seemingly benign residual tissue from a sessile serrated polyp can be a precursor, making the follow-up and the skill of the colonoscopist paramount for effective prevention. So, the take-home message is clear. The complete removal of sessile serrated polyps is a cornerstone of colorectal cancer prevention. It ensures that the potential for future cancer development from that specific site is eliminated. Should any doubt arise about the completeness of removal, a proactive and diligent follow-up plan with your healthcare provider provides the best path to continued colon health and peace of mind.